Yes, Dr. Ashwin.
Yes, sir.
First of all, I want to know about your achievements.
Yes, sir. I have done internship from the same college where I did my UG, sir. And during my internship period, I get a chance to do a lot of extractions. And other than that, I have also volunteered for the conferences which were held during my college time, sir. And I have also a part of NSS. For that, I have certificates for my continuous volunteering services, sir. And I have also volunteered the blood donation camp which were held during my college days, sir. Other than that, I have also attended various camps and Sunday camps also I have attended, sir.
Okay. What are your hobbies?
Sir, coming to my hobbies, I like watching cricket, sir, and exploring new places, meeting new personalities, and I would also like to listen to the music, sir.
What are your strong points, your strengths?
Sir, coming to my strength, as far as I am concerned, I am a loyal, self-confident, and a punctual person, sir.
You belong to which place?
Sir, I belong to Kanyakumari, which is popularly also known as Nanjil Nadu, sir.
Okay. Okay, coming with the medical portion, I want to know first of all about, tell me about how to prevent cavities.
Yes, sir. The main cause of cavities is food lodgement, sir. And other than that, improper brushing habits may also sometimes lead to cavities, sir. We can prevent them with the help of using proper mechanical methods like toothbrushing, and the main thing which is in the hands of patient to prevent cavities is that cleanliness of the oral cavity. Having proper oral health hygiene is what matters, sir.
Okay. You tell me about NOMA, N-O-M-A.
Noma, yes, sir. Noma is also known as cancrum oris. It's a kind of recurrent aphthous ulcer, sir, which occurs exclusively in oral cavity. The main causative organism for that are Fusobacterium and Borrelia vincenti, sir. It may be caused due to when increased stress period may be a risk factor. Other than that, low immune states like HIV and underlying other infections which suppress the body's immunity will lead to cancrum oris. The advanced stage may also lead to perforation of cheeks and oral cavities. And it can be managed with the help of antibacterials and hydrogen peroxide solution.
Tell about orodental trauma.
Orodental trauma, yes, sir. Orodental trauma, which the main etiology for orodental trauma is road traffic accident and sports injuries, sir. Sports injuries may be prevented by using various appliances like mouth guard and protection guard. It may be helpful for the patients to resist these injuries, sir. And RTA, wearing proper helmets and awareness is the only thing which is in our hands, sir. It can be managed based upon the amount of time which the tooth was out of the socket and many factors reliable, sir. The first thing we can manage by taking an X-ray and confirming the kind of fracture which has occurred, sir.
Tell about cleft lip and palate.
Cleft lip and palate, it is common among Africans, sir. And it is also it also occurs in Indian population. Cleft lip and cleft palate either can occur separately or together, sir. Cleft lip is of 4 types: unilateral, bilateral, midline, and combined, sir. Cleft palate combined may also come along with cleft lip and palate, sir. In the managements are various flap technique which consist of VY pushback and palatoplasty, and it is a combined technique which consists of assistance with physicians pediatricians, orthodontists, and treatment starts from 6 months, sir. At 6 months, we can start with cleft lip surgery. At 18 months, we can start with cleft palate surgery. And treatment comes up to 18 years, where the growth of the patient is completed. 18 years patient is treated with rhinoplasty and various obturators, etc. Sir.
Okay. What is edentullism?
Yes, sir. Adenolism is a state in which teeth are absent. It may be treated by giving a prosthesis which may be removable, fixed, with depending upon the condition of the oral cavity, sir. It is dependent on the ridge, amount of ridge which is there available to, and the space between the two arches are the critical factors which determines the amount of replacement which we can give. Nowadays, implant prostheses are also there for to replace the edonjulism, sir. Edonjulism is more common with age, sir. Increase in age, edonjulism is common, and periodontal disease may also play a vital role, which occurs due to loss of tooth, sir. And trauma may also lead to edonjulism, sir.
Okay. Tell about dentin hypersensitivity.
Dentin hypersensitivity is of two types, sir, type 1 and type 2.
Okay.
Main etiology is occlusal wear, sir.
Okay.
The concept of dentin hypersensitivity is that during attrition, enamel wears and the dentinal tubules are exposed, through which pulp is irritated, and we have patient experiences hypersensitivity when cold food or sweet food is absent. It may be treated with the amount of loss of the tooth material, sir. Whether depending upon the enamel or dentin, we have to choose the restorative form, sir. We can also treat them with crowns where the attrition is very severe. We can treat them with crown. Or bruxism patient may also affect with dentin hypersensitivity due to continuous loss of occlusal facet, sir. In that case, we can treat them with mouth guard, sir.
How you will handle the root infections?
Yes, sir. Root infections are solely treated by root canal therapy, sir. It is mainly three types of treatments are there. One is step back, another one is step up, and third one is combined. Depending upon the nature of the root and curvature of the root, we can treat the we can choose the method and do, sir. And various techniques are there. Most advanced technique is based on endodontic surgeries are also done in case of extensive root infections, sir. First, conservatively, we can also manage by taking an X-ray and with analgesics and antibiotics, sir.
Okay. So what type of antibiotics you are giving here?
Yes, sir. For extensive infections, we can give metronidazole, sir. And if the infection is in starting stage, we usually give broad spectrum antibiotics like penicillin, which is amoxicillin, sir. And thirdly, for analgesics, we give aceclofenac plus paracetamol, sir.
Okay. Are you not using any selective medicine in NSAID like atirocoxib?
No, sir.
It is giving good results. Atirocoxib. It is atirocoxib. It is giving. It is more selective. NSAID. Atirocoxib. What you are speaking?
Atirocoxib, yes, sir. Sir, but usually we don't prescribe that, sir. We prescribe aceclofenac, sir.
Aceclofenac is a derivative of diclofenac only. So there are certain side
effects. Yes, sir. Yes, sir. Atirocoxib has a better effect. It has low effect on GI, sir.
That's why I'm saying that atirocoxib
yes, sir.
more better.
But it's costly, sir. Patients can't afford this.
Single tablet, I think, is of 10-12 rupees.
Yes, sir. Yes, sir.
Costly. Okay, you tell me, how will you manage the bad breath?
Bad breath, sir. Yes, sir. Bad breath. The other terms which are commonly used to describe that is halitosis and oral malodor. it can be managed by proper cleaning of the oral cavity, which includes scaling and root planing. And we can also remove the sharpness of the plunger cups, which leads to impaction of food between the periodontal ligament, and which causes infection and that oral malodor. The second reason for oral malodor may be due to underlying systemic disease. The papillae of tongue may be elevated, and food tend to lodge between them. So we should treat the underlying disease to regress the growth of papillae of the tongue. Third, adjuvants like mouthwash and other ingredients like floss, we can advise, sir. Depends upon the patient's level of
pocket.
Yes, sir.
Okay. Tell about enamel erosion.
Enamel erosion. Yes, sir. Enamel erosion is due to two reasons, sir. One is external and other is internal. Internal may be because of systemic disease. Main disease which concerns enamel erosion is GERD, which is gastric esophageal reflux disorder. Because of that, the HCl from the stomach, which comes out through oral cavity, and it tends to wear the enamel of the tooth, sir. And second thing, externally, soft drinks which contains carbonated content, which will also be a great factor for erosion of oral cavity, sir.
Okay. Now my next question to you is, tell me about dry mouth.
Yes, sir. We can manage it with Silox, sir.
Okay.
The drug commonly used is physiostigmine. And the other reasons for dry mouth may be due to obstruction of obstruction of the salivary glands, which is usually treated surgically.
Okay.
And conservatively, we can manage by having some natural remedies like lemon or something which stimulates the salivary stimulation, like pickle or lemon, which tends to milking of the glands, sir, so that the duct which is closed will open automatically.
Okay, tell about teeth grinding.
Teeth grinding is otherwise known as attrition. It is a kind of pathologic wear which is due to unconscious action of patients, sir. It is mainly due to stress related and metabolism related. Attrition should be treated by occlusive splints, which is helpful for the patients to prevent them from biting, and some habit breaking appliances may also be given for them to stop the habit of grinding, sir.
Okay. Okay. How will you manage gingivitis?
Gingivitis is simply enlargement of gingiva, sir. It occurs due to various systemic conditions and illness of oral cavity due to improper oral hygiene methods, sir. Improper oral hygiene methods, we can remove the plaque accumulation from the tooth, and by doing simple scaling and root planing may be helpful in that case, and followed by proper brushing technique and mouthwash may be helpful in that case, sir. And conditioned enlargement in case of puberty and pregnancy, and due to various drugs like phenytoin, corticosteroids, and other systemic factors, which should be treated independently based upon the condition.
Okay. Okay, tell me about tooth abscess.
Sir, I beg your pardon, sir.
Tooth abscess.
Tooth abscess, yes, sir. Tooth abscess is simply accumulation of pus, which is more common due to infection. And tooth abscess is mainly due to two reasons. One is endodontic, another one is periodontic. Abscess is mainly common due to periodontal reason, which occurs due to food lodgement in the base of the tooth, which occurs and it leads to subsequent infection, then formation of abscess, sir. Abscess, in worst case, abscess may also spread to some spaces like buccal space or a masticatory space or canine space, which leads to space infections and swelling of. We can see swelling in the face of mouth, face of patients, sir. And the extreme stages, cellulitis or and Ludwig angina can be caused due to oral infections. Secondly, endodontic abscess occurs mainly due to endodontic pathway, which occurs due to food lodgement into, then which occurs subsequently in pulp, and pulpal infection goes to the root, and it causes infection in the apex of the tooth, which leads to abscess. It is usually managed with antibiotics, and the first and foremost treatment which works for abscess is drainage, which we can do externally.
What is the work of the drug serratiopeptidase?
Serratiopeptidase, yes, sir. It is usually advised in case of extensive infection which affects the bone, sir. It helps in other than reducing the inflammation, it helps in growth of bone and bone related substances.
Okay. In inflammation, mainly it works on swelling.
Yes, sir. So inflammation is swelling, sir.
Okay, what happens in inflammation?
Inflammation may be due to two reasons, sir. One is inflammatory response for the external agent. Second one is inflammatory reaction, sir. Inflammatory reaction occurs when the bone healing or healing process in other tissues occurs, sir. The first process in repair is inflammation, sir. And the other reason for inflammation may be due to external reasons like infections. And in that case, the fluid is the inflammatory fluid and is accumulated in the particular region, which tends to swelling of the particular area, and redness and tenderness will also be there, sir.
When you get injury, then also it is inflammation only, because redness will occur, swelling will occur, pain will be there. These are all the elements of inflammation only. So inflammation are of two things, like one is injury, another is infection. Two ways.
Yes, sir.
Okay, tell me about selective and non-selective NSAIDs.
Selective NSAIDs. Sir, I have to refresh, sir.
Just now we talked. Etocoxib is selective.
Yes, sir. Etocoxib is selective, sir.
When you
the
were
other
in
thing,
school,
diclofenac and aceclofenac are non-selective, sir.
When you were in schooling,
yes,
then
sir.
two salt came, rofecoxib and celecoxib. You were in which
yes,
class
sir.
in 2000?
2000.
2003,
sir, I was
2002.
in. No, sir. I was barely in pre-KG.
Which class?
Pre-KG, sir.
Pre-KG. When you were in 2003, I think you were in 5th standard, 4th standard.
Yes, sir.
So that time one salt came, celecoxib.
Yes, sir.
Then rofecoxib, another version of.
Yes, sir.
But they both got banned.
Okay, sir.
Then comes this etocoxib.
Okay. Yeah, yes, sir. I've heard about that drug. That cause heart problems, sir.
Yes. They got banned. Even
yes,
nimesulide and paracetamol, this combination
is
banned in the world. Many countries. Nimesulide and paracetamol is not a good combination, actually.
Okay.
Even nimesulide is not a good drug. It affects our liver.
Okay.
So nimesulide should not be given to kids, especially. But in India, everything is running. Nimesulide syrup, nimesulide cake.
India.
And combinations are available of more than 4 drugs, 5 drugs, combinations, lot many drugs. But in foreign many countries, combinations are not allowed.
Yes, sir.
Knowledge is good.
Sir.
I appreciate your knowledge. Okay, why do you choose army as your career?
My father, who was an ex-serviceman, has instilled values of discipline and dedication in me, which has motivated me to take up this profession as my career, sir.
See, we have lot many candidates coming for ADC. Why should we recruit you?
Sir, I know that I am not in the place to judge others, but I think I am really capable and I have worked very hard for this Army Dental Corps interview, sir. And I really need a chance to prove my strength, sir. And if I get a chance, I will work with my 100% and dedicate it towards my Army Dental family, sir. And I have also various. I'm a service-minded person, and I have certificates from NSS for my continuous volunteering service. And I have also volunteered the culturals and conferences which were held during my college period. So I think I'm the most eligible candidate for this profession.
Okay. Very good. Appreciable. Super. Good confidence.
Thank you, sir.
बहुत अच्छा बोले.